Hi, I'm Peggy Pringle, Associate Vice President for Practice Management Services at the Texas Medical Association. And we're here today to talk about ICD-10 with Steve Arter, who's CEO of Complete Practice Resources. Steve is also an author and an educator. And also Denny Flint, who's President of Complete Practice Resources and a former CEO. So Steve and Denny, there's a lot of confusion about ICD-10 versus ICD-11. Can you give us some clarification on that?
I think that much of the confusion about ICD-10 versus ICD-11 is whether we're going to skip ICD-10 and go directly to ICD-11. I believe it's very unlikely to happen for a host of reasons. The most important of which is that ICD-11, though it is projected to be completed by 2015, that does not include the clinical modifications. And by not including those clinical modifications, it's not going to be suitable for billing purposes. Mm-hmm. Best guess estimates, and I know people that are on the ICD-11 panel, are that clinical modifications will take another 4 years. That puts us out to 2019 or 2020 before we can actually use ICD-11. It's just not feasible. We cannot continue to go. It will hamper the business operations of physicians, medical practices, everybody, if we wait until 2020 for another diagnosis code set. The damage, I think, will be huge. We will have to try and recapture ICD-9. ICD-9 is just not robust enough. There's not enough ability left in ICD-9 or flexibility in ICD-9 to go forward. So I see it as very, very unlikely that we will put off ICD-10 and wait for ICD-11.
Okay, thank you.